Concussion is actually a functional diagnosis. The best way of describing it is what you'd call cognitive impairment of the function of the brain, which means there's some sort of impairment of brain function as a result of direct trauma. Concussion is really only one condition, but there are a lot of grades of concussion, from very mild symptoms like a minor headache to quite severe concussion, which results in loss of consciousness, and symptoms and signs can remain for some weeks or occasionally even up to months. So yes, there are varying degrees of concussion and varying severities. Well, the first signs of concussion is to the observer, who may see an athlete suffer concussion. So if you see somebody lose consciousness as a result of head trauma, you immediately diagnose concussion causing loss of consciousness. But most people don't have that. They usually present with symptoms of concussion first. In other words, they report that they've had a head knock of some type, playing sport, and they report symptoms such as headache, drowsiness, dizziness, nausea, blurred vision, unsteadiness, inability to maintain good balance. So they would be the commonest symptoms of concussion, and there aren't very many signs of concussion, particularly in the on-field assessment, but they can be things such as observing unsteadiness on the feet, and then as a result of that we then might do some certain types of concussion tests. The first thing we ask them is what we call the Maddox questions, and they are essentially, where are we, who you're playing, if it's a sport, what time of the day is it, what quarter is it, what was the last score. In other words, immediate recall type questions to ask the athlete to ascertain whether they're familiar with their current surroundings. Then if we suspect concussion, we often do a more advanced test called a SCAT, which means Standardised Concussion Assessment Tool. And that's a little bit more sophisticated. We do things like number recall, word recall. We do a couple of balance tests. And again, these tests are done on the sideline during competition, during a game. Or we can also do them in the office the next day or the day after to assess how they're progressing once we've diagnosed concussion. There really is no active treatment. The main treatment is rest. You must rest the brain and rest the body from, first of all, from any exercise, and secondly from any competition where they're at risk of getting trauma to the head again. So rest is probably 99% of the treatment. The extra treatment is really just the symptoms. In other words, a bit of mild analgesia such as Panadol, Panadine for headaches, medication to help with nausea, but otherwise it's really rest. Well, in the immediate period, you can expect a few days of symptoms such as I've described before: headache, nausea, lightheadedness. They often report a feeling of cloudiness or inability to concentrate, etc. So we advise them that they can expect to be like that for a few days, but the average time that it takes to resolve those symptoms is commonly 7 to 10 days. So we're pretty confident within a week or so most people will recover, so they can expect these symptoms to resolve. The big debate obviously is the wearing of head protection gear, and certainly at this point there's no evidence to show that headgear protects or reduces the incidence of concussion in contact sports such as football codes. However, we still recommend that in the high-risk activities such as cycling, skateboarding, equestrian, where the risk of a high-intensity, high-speed fall on a hard ground that you might experience, helmets are recommended for those activities. But in the contact sports, we don't recommend headgear. The only other preventative thing we can recommend is changing rules to reduce the incidence of high contact to the head region, and certainly AFL does lead the way there in some of its rules regarding head contact, and just in trying to improve the skill base of the athlete so that they are able to try and avoid head contact where possible. But of course in contact sports that's not always the case.